Jack, testosterone discussion some more. And I'm really excited to talk about this because it's really something that everyone thinks testosterone replacement therapy isn't good for you. It's going to cause heart disease. You should just live with having low T.
Yeah, and that's completely untrue. It was this week. This was interesting. I found this very interesting, and it crosses over with us. But for years, estrogen replacement has been stigmatized, and physicians have really gotten away from estrogen replacement. And I think there was some evidence, but it was really never solidly confirmed. Some evidence of a link to breast cancer with estrogen. And women and the Go Pink movement and breast cancer prevention and early mammograms have really put a dent in the fatal cases of breast cancer. But like I said, a lot of people, because of that fear, have gotten away from estrogen. Well, this week they've announced there was a new study that came out that debunked a lot of that. So I think there's hope for women um, as well in this field for improved vitality. And I mean, I like this idea for my patients as well. If they're women, if their significant others are getting more healthy and or more optimally balanced in their estrogen level, um, you got both partners who are, keeping up with one another. I think, some of the men, I've heard this complaint with men is that, that if I increase my libido or, my wife doesn't want me to go on testosterone, she thinks I'm going to be cheating on her. Um, kind of there's, we battle a lot of different nuanced treatments or nuanced roadblocks to treatment. And that's always been one of them. But I think, I'm hopeful that if estrogen replacement starts becoming more of a common thing, it will encourage the men to, if my wife is going to be healthy and vibrant and youthful, I need to keep up with her. And I think that's the best thing that could happen for marriages, for couples. Menopause is really it's painful for women. It's it destroys a lot of their confidence if they can't perform. But a lot of the same benefits that we talk about with testosterone for men is true for women. So I was glad to hear that coming out. But and we've talked about this. Testosterone really is a youth elixir. You don't want to promote it as that. That almost makes it sound like snake oil, but it truly is. It is truly something that has multiple effects on, throughout your body. We've talked about this a number of times that, testosterone will lower that belly fat. In our last episode, we talked about how damaging that visceral fat is and how harmful that is to your overall health. Um, Testosterone will redistribute. You burn your calories better because it's increasing your muscle mass, so you're able to metabolize better, but it also primarily burns a lot of that deep belly fat. So that's one of the first things that you'll see in guys, on top of the mental acuity. Guys will notice within weeks of starting the testosterone that, their mojo is back. They're a little funnier. They're a little less cranky. They're not so moody at the end of the day. And that's something that, once again, the spouses enjoy that. He's interested in doing things on the weekend, not just laying in front of the TV. Um, so, some of those things that the testosterone does for the man is also, very welcomed by their partners. And like I said, especially if we can get, both the male and the female member, or, I mean, same-sex couples as well, but, to optimize both men's and women's testosterone and estrogen levels simultaneously is a great thing for marriages. Who knows what role menopause and testosterone deficiency have had on, the divorce rate. I mean, That'd be an interesting study, how you would link that. But, look at the estrogen level or the testosterone level of divorced and happily married couples. You may find some correlation there. Um, I think that's a lot of the time when, when marriages start having problems is when you're also that same time when you're having hormone deficiencies. And, in general, across the board, we're finding 30-year-old men who, their testosterone level is what a 60-year-old man used to be in the 70s. You even look at those old photos of like the Penn State players from 1980, 1975. And a lot of these guys, I mean, they're full beards, they've got this very masculine look. And you look at guys now, there's more of a feminine appearance. It seems like men are not maturing in that same way. And that goes back to the food. All the stress on our bodies, first of all, from the phone. You're constantly flipping through your phone. You're, you know, sitting for hours, doing nothing as opposed to up and moving. So the technology has affected it. The ultra high processed foods that we eat, have filled our bodies with toxins so that your testicles don't function as well as they used to. And you see a lot of these kids, the generations we're seeing now, they grew up with, their first food was those little cheese crackers, the little fish crackers, Cheerios, all this like processed food that our kids are exposed to at a younger and younger age. A lot of their tissues never get to develop in the same way. So, they're prone to obesity. I think it's 25 or 30% of, high school kids or even younger have signs of type 2 diabetes. The obesity in the young children is horrible. So it's becoming a lifelong struggle to maintain proper functioning of all of our body parts. But for boys, especially like as they're going through puberty, if their testicles aren't, well nourished and they're full of toxins and sugar and carbs, they just don't function the same. They're not secreting the same amount of testosterone. So we've seen a complete and total holistic decline of of our youth, our kids. Their participation in sports is not what it used to be, and there's probably a lot of factors for that as well. But like I said, what I'm seeing, I've seen some guys in their 30s whose testosterone level, I had one guy, his testosterone level was 125, and he was like 32 years old. I mean, that's, I'm not sure that there's women with the same level, but that is an extremely low level. Below 300 is considered low T. And if you got a 30-year-old with a level of 125, that's just pitiful. They're depressed, these kids. They have a lot of issues and, both physical as well as mental. So I think, typically we will do a free testosterone test. If someone is interested, we will take the hit, if you will, for the blood work,
Hmm.
because it's so important to diagnose it. And once you've diagnosed it, and they find that their level, they see that number, and they're like, "Holy cow, doc! Wow, no wonder."
Right.
No wonder I come home at the end of the day and I just crash on the couch. I don't have the same energy. I don't like going for walks. There's so many things. And if you can correlate that with a number, you know, guys are once they get their number, they're like, "Oh, what is it now? What is it?" And when you see it go up and you see it correlate to your wellness, how you're feeling, um, it gives you something to follow. So to come in for a free test and a discussion about the benefits of testosterone, is something we've found is just, it breaks open the door. Well, hey, if I don't got to pay for it, why not? And of course the treatment, is an expense, but it's a very worthwhile treatment. You go on blood pressure pills or you go on cholesterol pills, you don't feel any different. You can't tell, a lot of guys with this, especially cholesterol medicines, well, my cholesterol went from this to this. You don't feel any different, so it's not something that there's a lot of motivation for continuing. Um, Whereas with testosterone, once guys get on it and they see the improvement and they look in the mirror and they're like, oh, wow, I'm actually getting some muscle mass back. I'm getting rid of some of the man boobs. There's a lot of immediately visible and noticeable improvements, especially with the mental acuity and the moods, and you're happier. So it's something that I'm a big proponent and fan of it for so many things. And the thing that people, there were studies back in the 70s that showed, perhaps some relationship of testosterone to coronary artery disease. Well, the study that came out was called TOM. They use it as testosterone in older men. So some of those early tests were done on older patients. So it wasn't as clear to tease out what effect was from testosterone and what effect was from just being older. These patients they had cardiovascular issues to begin with. So there became some association with it years ago. But in the 20 teens, there was a study came out, the Traverse study, that debunked all that, that actually showed that low testosterone had a higher rate of cardiovascular effects. But once some of these, even within physician communities, once some of these stigma and these treating patterns, the way that, physicians treat patients in a very structured way that they've done for years, and they get into this pattern of, oh, I don't like treating patients with testosterone because, you know, but before they know it, 10 years into their career or more, the science has changed, the research has changed, and, to break those old habits is sometimes hard. But study after study has been showing lately that, the cardiovascular effects of testosterone are positive. The other thing, both for estrogen and testosterone, is bone strength. And if you get a hip fracture, if you develop a hip fracture um, in your 70s or 80s, which is very common, that's one of our most common patient in an orthopedic practice is someone with a hip fracture. The mortality rate, not just morbidity, not just your complications, there's blood clots, there's pulmonary embolisms, there's pressure sores, bed sores, a lot of complications from getting a hip fracture, plus a decline in function. The most patients, when they get a hip fracture, you can expect them to have, a level down of their ambulatory ability. If you were an independent ambulator before you break your hip, you have a significant risk of needing a cane afterwards. If you've used a cane before you break your hip, it's likely you have a significantly higher rate of needing a walker. If you use the walker, you may be wheelchair bound. So, a hip fracture is a very dangerous and very, high morbidity condition to have. And both estrogen as well as testosterone are associated with a high, low testosterone, low estrogen rate are go along with an increased rate of hip fractures.
And well, I didn't, that's wild to know. I
Yeah.
didn't.
And, women, osteoporotic fractures in women. And that's why I'm really so glad to see estrogen coming back on the scene. I think that's going to save a lot of women from wrist fractures, hip fractures, shoulder fractures, fractures across the board. Um, but same in men. Men don't get the same, everybody has, here's the scoop on your bone density. Okay. Your bone density is at its highest percentage somewhere around age 27. That's about your peak bone density. And then everyone goes through a natural decline over time. But women also go through an accelerated decline in their bone mass after menopause. So when women are going through menopause, if you can delay some of that bone density growth, especially women if they've had, ovarians removed, their ovaries removed, and they've had a forced, medical menopause that was done early. The idea of estrogen replacement is fantastic for that's going to reduce the rate of bone fractures tremendously if more women get on estrogen. And the bone, the medications like Boniva, there's medications that help to maintain your bone density. A lot of them also have, this is counterintuitive, that the risk of some of these these osteoporotic treatments, the risk is that there's an increased rate of hip fractures, you know, and you're like, why is that? That doesn't make any sense. And what happens is that some of these medications, and I've seen this in my practice, women who are on these medications, they come in with hip pain and you check an x-ray and they've got sometimes multiple stress fractures in their hips, in their bones. And you see these fine little lines on the x-ray, or sometimes you even see little, fractures that have deformed the shape of the femur. And the reason for that is by adding the calcium to the bone without adding the collagen increases brittleness of the bone. So even though it makes it more dense, it makes it more brittle. And, a part of the bone's strength has to do with its flexibility, which comes from the collagen that's in the bone. And I don't think this is beyond the scope of but we get into, some of, mechanics and, biomechanics. And, it's that ratio of collagen to calcium in the bone that gives it its strength. And some of these medications increase calcium absorption without increasing collagen formation. Whereas, testosterone and estrogen, they maintain both collagen and calcium so that it is an actual, not just a denser bone, but it's a stronger bone. So, I think testosterone and estrogen both are hugely beneficial for bone strength to prevent those fractures. If you can prevent an osteoporotic fracture, you have increased someone's lifespan, not just their health span and their lifespan, but, a lot of people die, within the first year of a hip fracture. So to be able to prevent that is great. And testosterone is one of the best ways to prevent those osteoporotic fractures. Um, and that's not something we've gone into a lot in some of our previous episodes, but that's a huge, huge benefit to it. Um, what else, Neil? What am I missing? Well, the sexual
Yeah.
health is, you
Yeah.
know, you
We
know,
talked a lot about that. I
yeah,
mean, and it helps definitely you feel sexual health as well.
hmm yeah, absolutely. The libido will go up, the interest in it. Um, and like I said, it's a major part of what we deal with. But it really is, I mean, that's a luxury, to have good sexual health. And a lot of guys, they're either in a marriage that's not important to them. But even if the sexual health isn't something that you're, really focused on, your health is something. This is, by replacing testosterone, it's really a way to improve your quality of life. And those are the guys who are 60, but look 40. Those guys usually, a lot of those guys who have been optimizing their testosterone, staying healthy, maintaining their testosterone, will look good into their 60s and 70s. A lot of the guys who are 40 and look 60, those are guys who've probably had low T from the time they were in their 30s or 20s. So, testosterone is really, it's not strictly or, just something that's beneficial for sexual health, but overall health. And, there's no reason why you shouldn't have it checked, for your cardiac function, your brain function, your body, your bones and muscles. It's really something that especially nowadays with the diets, men should be getting their testosterone checked, every year or 2 years. It's not a mandatory test or a recommended test, but from what I see in the office, the number of guys with low T who have no idea
Yeah.
it's
So what is the
startling.
number? Does the number vary your age or not? Remember they say you like at one point I was shown as average. And average is not, that's what they want to say for your age, but
Yeah.
it's not good. It's not great. You're there. You're not low T, but it really is not fun.
No. And the thing that I don't like about that at all is there is no absolute normal blood level for testosterone. It's based on the population. So if you got 100, you take 100 random guys
Really?
from the street, 100 random guys from the street, they will find a median and standard deviation from that median to come up with the normal, quote unquote, the normal.
Right.
But the normal nowadays, it's a normal, it's an average level for a bunch of men who have lower testosterone levels. If you were to test, and I said that the LabCorp has changed their reference range because they're now seeing guys that have phase shifted down from what it was in the 70s. Your average
Mhm.
level in the 70s was 5, 6, 700 probably. Now your average level is probably around 400. And all these societies make recommendations on what's, they have a
Mhm.
committee and they come up with a recommendation for what
Right.
defines low T. They have to make recommendations.
Uh,
And right now, 300, below 300 is considered absolutely low T, you know.
wow. Okay.
But guys with a level of 400 who still have significant symptoms may also be considered low T. And a lot of there's genetic reasons, there's cultural, reasons for, some cultures have higher, some individuals have a normal level that's higher. Guys like us with our bald heads, Neil, we've had higher testosterone levels our whole lives. So
Yeah.
when it goes down, one of the side effects of testosterone is hair loss.
I didn't know that. Okay.
Yeah, when you get that
So
typical male pattern
I think
baldness.
what a great conversation would be for people who are, let's say they got testosterone replacement therapy, but they didn't talk to a men's doctor. They got, there's ways of just going to a doctor, going to the right doctor. They'll get you and prescribe you this, but you don't know what to do through that process. I think
Mhm.
that would be a great podcast we can do next because
Yeah,
I'm sharing this. I am doing testosterone replacement therapy. I'm not embarrassed to say it. And you heard about it with the golfers, right? That they don't know if the golfers should be used doing testosterone replacement therapy anymore because they get a competitive edge. You didn't see that? You hear
like I
about?
said, yeah, of course.
Yeah,
And it's
and I don't
like
know
I said,
about
it
the
gets into the
NFL's rules. What's the NFL's rules on that? Like if you're like 40, are you allowed to use testosterone replacement therapy?
yeah. I mean, I think it's considered a medical treatment. It's not a performance enhancing substance, but it has been used as a performance enhancing substance by certain, weightlifters.
What level is it? Like high levels of it for
Well,
the.
I don't try to go above 1,000.
But
I
what do the
think,
weightlifters use it for?
yeah,
Like
I mean, the
big.
weightlifters, they might be jacking it up to 2, 3,000. They do,
Is that different than
it's
human
a,
growth hormone?
yeah, it's
HGH?
different
It's
from,
different.
yeah,
It's
different
different
from
than
HGH.
HGH.
Yeah.
Okay. But who
And
did that? So they did a mix of HGH, steroids, and that. Is that why
yeah.
we're seeing these unreal specimens in happening now? I
And a
mean,
lot of the things that there are peptides now that guys are using peptides that help to boost human growth hormone, HGH. So some of the peptides, which we also deal with, can also help with healing, recovery, muscle strength. Guys are, peptides, we have access to a good, well qualified, reliable distributor, source for peptides as well. And that's something that we're going to see more of in the future, because there are ways to improve your own HGH production, your own testosterone, through some of these peptides. And it's going to be exciting over the
mhm.
next few years. I think that's really going to break through in what I consider the wellness market
Yeah, I
as
love it.
opposed to the illness market. Yeah, people
Well,
need to rely on your physician anymore, to rely on the system of healthcare to
no.
take care of these wellness, they're geared towards treating illness as well.
Why
When
do
I
you
say
think I
the
work with
heart
so many
attack,
doctors?
say it again.
Because I have a plethora of people to go to because I have all my doctors as friends.
Yeah,
It's a
you're
good
you're
thing.
You're blessed there, Neil, but your
and
average
and the
person,
financial side and the wealth side, and there you go. And I have the marketing side. So
yeah,
it's a great 1-2 punch. All right. So I love this. I would love to schedule another podcast with you to discuss. Okay, now I'm on testosterone replacement therapy. What do I do next? And that will be really, really good because I'm dieting a little differently than I did before because I saw the first cycle and how it did. And let's talk about that. Let's
yeah,
talk about optimization of that so we have the most success so that we don't go through these spells. And what someone needs versus somebody else needs is a totally different situation. And that's talking to your doctor to figure that out. And if
yeah,
you're just going on it and then they say, "Oh, I just saw your levels," you need to talk to them. That's the thing, Dr. Jack. What you do at your clinic is you talk to the individuals. You don't just say, "Okay, your levels are down. Okay, I'm doing this." You're not you ask them questions. And a
yeah.
lot of
And
times you're not going to get a health professional to do that.
right, we require our patients to go through a testing every 3 months. And they don't have to come to our office for that. There, we send them to LabCorp frequently, or they go to a lab near them to check. But I'm calling my patients every 3 months at least, saying, how are you feeling? How, are you, oh, my mental is great. My wife is appreciating you. Thank you, doc. Um,
I tell you, my mental of giving up caffeine and still being able to, I know it's from that because my
yeah,
mental is just it's crazy. But it makes me reflect more. So a lot of the cobwebs have gone in this, but
yeah,
but you still have to work on the mental health side too. And
right.
that's the challenge that we could discuss is what are we dealing with? Little side effects. How do we develop the right mental health professional? But go to a holistic clinic like yours. You're going to talk mental health and to have those discussions.
Hmm.
That's the difference of your holistic being a men's clinic versus going to somebody else for prescription. Explain that real quick before we finish.
Exactly. Yeah. I was going to say the other thing, you're right. If you can't just take the testosterone, you can. If you just take the testosterone, you'll improve. But if you take the testosterone and you diet well, and you go to the gym, and you're improving your sex life, these things, it's not 1 + 1 = 2, it's 1 + 1 = 5 or 6, the improvement that you get. And the other thing that I really want to talk about that I think is hugely, we talk about the toxins and the free radicals in our system from the food. We have a product that minimizes and reduces some of those free radicals in your body so that your cells do function better. You can't just go, blood pressure, antihypertensive, sugar test, anti-sugar. Typically it's, with the typical, big pharma route, it's A equals reflex B. And then reflex B creates another side effect that you need reflex C. So the idea of looking at all of these concurrently, looking at your mental health, your weight, your testosterone level, your general, body function, um, and modifying it with diet, with exercise, with some supplements, I think is a much more solid approach as opposed to being on 6 medications by the time you're 60. It's the way things were meant to be, and we have the technology and the products nowadays that we can treat and maintain wellness, not just wait for illness and put them on a medication. So it's the way I do. It's the way I live my life. I try to stay away from medications. I try to eat well, and you can staying out of the doctor's office is the best thing you can do for your health a lot of
Right.
times,
Okay.
not, by preventing it before it gets to be a serious issue.
All right. So go to the ultimatemensclinic.com in New Bedford, Massachusetts. If you're not in New Bedford, Massachusetts, you got to go ahead and contact him because I'm in Mentor Cleveland area and I am doing consultation with Dr. Rocco and I'm able to do it and be able to be on this therapy and have communication with him on a regular basis. So that's what you guys have to do is if you're in the country and you're like, you know what, I want to talk to a man, not a woman or not a man that understands my needs. Dr. Jack will understand. Appreciate it, Dr. Jack.
I appreciate it, Neil. Thank
All
you
right.
so much.
That